Hi, this is Shelley Kraft. We're coming to you live on SNNLive. We're at Biotech Week here in San Francisco 2014. With me is Mike Oliver of SpectraScience, publicly traded company, and the symbol is SCIE. Mike, welcome back to SNNLive.
Well, thank you very much, Shelley. I appreciate you having me.
It's good to have you. Please tell our audience a brief overview, and then I'll come back for updates.
SpectraScience is a biophotonics company, and our first application of our technology is to use light to diagnose cancer in vivo. In other words, while the tissue is still in the patient. What's really important about it is we do it less costly than traditional pathology, and we do it in real time. And by real time, I mean about 1 second.
You know, when you typically come to the Biotech Week, there are advancement after advancement, almost stepping on one another. Where do you see yourselves, obviously Spectra, in that greater scheme?
Well, we're really encouraged by what we're seeing in Europe right now and the adoption of our technology. We're working in many of the major countries in Europe, and we've got opportunities there that are truly encouraging for us.
So now, let's talk about that. Do you have an update since I've last seen you?
Well, that was only a few weeks ago. However, we have had some interesting developments on potential opportunities in the UK. The UK is a very interesting market. It is very much dominated by the National Health Service, which is their public health service program. And there's really an opportunity for us there to, as in other countries, become the recognized standard of care. And that would be a quantum leap in placements for us and obviously revenue as well.
How many cancers can you work with?
Well, today the first approved indication is for colorectal cancer, so the answer short term is 1. However, the technology has applications in skin cancer and breast cancer and brain cancer and cervical cancer and probably half a dozen others that I've omitted here.
So where do you see the company 2014? We have almost a year ahead, and 15.
Well, 2014 is going to be a real focus on commercialization in Europe of our current indication, and then a launch later this year in the United States for the colorectal cancer application. That's a lower GI application. We also think that we can have a prototype available in the market, maybe not ready for commercialization, but pretty much completed in late 2014 for the upper GI as well. We're in discussions with a number of other companies about other indications that we might develop. Those are a little bit further down the road, 2015 and beyond.
And of course, you know me. I want to know as much as I can that you're allowed to tell me. Okay, Mike, now for more information, how can people find out?
www.spectrascience.com, spelled SPECTRASCIENCE, one word, .com.
Ladies and gentlemen, Michael Oliver from SpectraScience, publicly traded company, and the symbol is SCIE. I'm Shelley Kraft. This is SNNLive. We're at the Biotech Week here in San Francisco 2014. Mike?
Shelley, it's always a pleasure. Thank you again.